Today we're going to talk about the Chapter 4 guidelines in the ICD-10-CM codebook. Specifically, diabetes is covered very much so in these guidelines. Some things you need to remember about coding diabetes. You can code as many codes as you need to code to fully describe an encounter. Often a person with diabetes will have many complications or manifestations of the disease that need to be included, and many have combination codes. So the code would represent diabetes with whatever the situation is, and it's okay to use as many of those as you need to code. Their sequence, or which one goes first, would be based on the reason for the encounter, whether it's the admission to the hospital or while they're in the doctor's office. And as I said earlier, you can assign as many categories, as many codes as you need to from those categories to identify all the associated conditions. The first guideline has to do with the default. That means if the documentation does not tell the coder what type of diabetes a patient has, the guideline instructs us to code to the default, which is E11 point dash, which is type 2. You may remember point dash, that dash tells you additional characters are needed. So if there's no other complications with this person with diabetes, it's going to be an E11.9, indicating he does have diabetes, no complications or other specified problems. And the hypertension is I10. The next guideline has to do with the use of insulin and oral hypoglycemics. 2017 guidelines added a code for the use of oral hypoglycemics. The use of insulin was already in the code book and in the guidelines. But this scenario, the doctor documents the patient's new to our practice with a diagnosis of diabetes and uses insulin to control her blood sugar. The guideline tells us if the documentation does not indicate the type of diabetes but does indicate the patient uses insulin, you're going to code type 2, E11, meaning you're going to go into that category and choose the code that has the correct characters. No complications are mentioned, so E11.9 would be the correct code for the diabetes, and then the use of insulin to control the blood sugar would be Z79.4. And you see in the index that comes under long-term drug therapy. Then I have a note at the bottom of this slide that if a patient is in the ER, for example, and insulin is given to bring down their blood sugar temporarily, they've not been on it long-term, then you would not code that Z79.4. That is only for the use of insulin long-term. And this is the same scenario, only this time the doctor has documented the patient is using oral hypoglycemic medication, which is a different code, Z79.84. It also comes under long-term drug therapy. The next guideline has to do with diabetes in pregnancy and diabetes that is gestational. Both of those conditions refer the coder to Chapter 15, which is the OB chapter in the code book. We won't spend too much time on this, but I wanted to at least introduce it and then know that you will often see codes for pregnancy complicated by whatever the situation is. And when you look at diabetes, there is an entry, a subterm for pre-existing type 1. I also have here on the left a note to you that the coder must be alert to the difference between the letter O and the number 0. They don't look the same. So you have to be sure if you are handwriting, for example, I would put a mark through the 0 to indicate it's a 0. But if you're typing, you simply have to really read carefully. In ICD-10-CM, the first character in a code is not a number, so it has to be the letter O if it's a part of a code. 024.012 is the code for pregnancy complicated by diabetes pre-existing type 1. You notice that in the index there's 024.01 dash. The dash is the last character to the sixth character, which is the trimester. And I have a note here on the left that 16 weeks is the second trimester, so 2 would be your sixth character in that code. Type 1 diabetes codes to E10.9. And then whenever we are coding pregnancy, we're going to be coding weeks of gestation, and that's the Z3A.16. Then I have the guideline from Chapter 15 telling us we have to use the category 024 for the diabetes, followed by the appropriate diabetes code. This is not the same as gestational diabetes. That's a separate diagnosis and a separate guideline and a different code. Pre-existing, obviously the patient had the diabetes before the pregnancy. Gestational is when the patient has developed diabetes as a result of the pregnancy. The next guideline has to do with the underdose of insulin due to an insulin pump failure. When pumps fail, they're either going to deliver too much insulin or too little. And underdosing, if you remember from the table of drugs and chemicals, underdosing has a unique column specific to that type of problem, T38.3X6, and they would add a 7th character for the initial encounter. However, the first code, the T85, the complication of the pump due to a mechanical breakdown, is your principal diagnosis. And if you read there in your guideline under the rationale, it tells you to assign a code to T85.6 that specifies the type of pump malfunction as the principal. And that's followed by code T38.3X6- underdosing of insulin and oral hypoglycemic, and then additional codes for the type of diabetes and any associated complications due to the insulin underdosing. The next slide has to do with the overdose of insulin due to insulin pump failure, and in this case, an overdose falls in the poisoning column in the table of drugs and chemicals. Again, T85 would be the category that would be our principal diagnosis, followed by the code for the poisoning or the overdose of the insulin, then the type of diabetes with any resulting problems because of this. In this case, the patient's being treated for hypoglycemia with their diabetes. Let's talk for a bit about secondary diabetes. Secondary diabetes is always caused by another condition or an event. Examples are cystic fibrosis, cancer of the pancreas, a pancreatectomy, or in other words, the removal of the pancreas, or an adverse effect of a drug, or poisoning. As a reminder, adverse effect means the patient has taken the medication in the prescribed dose, in the prescribed manner, and still had an adverse effect. A poisoning is if the patient has taken too much of a medication or more than was prescribed by the physician. Codes under categories E08, which is due to underlying condition, E09, which is drug or chemical induced, and E13, which are other types of specified diabetes. You're going to identify any complications that are associated with that secondary diabetes mellitus. And the sequencing of the secondary codes is going to be given in the instructional notes that follow the codes in those categories. Always look to your instructional notes in the tabular to help you know how to sequence these codes. This slide has to do with secondary diabetes due to a pancreatectomy or the removal of the pancreas. And the diagnostic statement tells us the patient has no complications related to diabetes and uses insulin to control his diabetes. If you read the guideline, it tells you the codes that you're going to be needing at a minimum. And then when you look up your codes, it also tells you in the instructional notes the codes you're going to be needing. So there's not a lot of guesswork here. The guidelines actually tell you exactly how to sequence these codes. E89.1 is your post-procedural hypoinsulinemia. And you see it also when you look it up in the index, it can show you a post-pancreatectomy hyperglycemia. Those two things, one says hypo, one says hyper. The fact that you have not enough insulin, a hypoinsulinemia, leads to the patient developing too much sugar, hyperglycemia. So they are connected, but they are correct as written. Then you go into assign a code from category E13, which is your diabetes specified type. According to your guidelines, tells you exactly what to code. And then code Z90.41- to show the acquired absence of the pancreas because it's been removed. And then the statement tells us insulin is being used, so you're going to add the Z79.4. So at a minimum, you would have 4 codes for secondary diabetes due to pancreatectomy. You can also develop secondary diabetes due to drugs, and the example I've given you here is taken from one of your homework exercises where the patient has developed diabetes with diabetic nephropathy following the use of this drug, physostigmine, which is an anticholinesterase agent. Nephropathy, if you remember from your medical terminology, nephro, N-E-P-H-R-O, means kidney. So the patient has developed kidney problems following the use of this drug. It tells us that the patient did not take any more of the drug than once prescribed. It also tells us why the patient was receiving this drug, to augment muscular contractions in the treatment of myasthenia gravis without exacerbation. The patient has used insulin to manage her diabetes since this developed, and this is a subsequent encounter. Remember, subsequent is the letter D as your 7th character. There are guidelines in chapter 19 and 20, which are where it says here in the rationale, see section 1C19E and 1C20 to tell you how to sequence those. I didn't reproduce those for the sake of saving space, but you can see how E09.21 code first. Then the T49 is the adverse effect of the drug, and I said adverse effect because the patient, the statement tells us, did not take any more of the drug than was prescribed. Long-term therapy of insulin, Z79.4, and the myasthenia gravis we want to also code. That's all the guidelines I'm going to go over for Chapter 4. If you have any questions relating to these guidelines, please post them in the discussion board. If you have a specific code that you're looking for, please post the path that you look for to look for your answer, and I will answer your question there. Thank you so much and have a good day.